Right now, a group of leaders around the KC metro area, they meet every month to discuss crime, but as a public health issue instead, just like drug addiction or mental health. This includes school leaders, police officers, civic leaders. So now they're working on the campaign. March 2015, nearly 24 people at this Kansas City park, 24.
And I've yet to seek justice.
Hassan Williams was just 18, months from his high school graduation.
So I had to walk across the stage and accept his diploma. Those are the things that we're dealing with in our communities. People not willing to step up, keeping silent to violent crimes.
A new initiative is hoping to lend a voice so that other mothers don't feel the same pain as Kendra Jackson. Right now, several groups, including top brass with KCPD, KC Public Schools, judicial leaders, civic groups, and more, all teaming up with the Kansas City Health Department. The goal is to tackle crime as a public health issue on the front end instead of a public safety one.
The violent act is simply the outcome.
Shane Brettauer's organization is tasked with drafting the narrative, one that hopes to evolve into an education and possibly ad campaign, much like the war on drugs or mental health.
But we're really focusing on the other side, which is really about the trauma associated with violence, and that's the true disease that perpetuates additional violence and future violent acts.
It's a disease Jackson says needs to be recognized on the front end.
Violence doesn't start when someone pulls the trigger. There have been things there that have led up to this point.
She says identifying it instead of just a reactive approach can save even more lives.
Kendra, what would it mean to your son's legacy if something A like this were rolled out and B were a success?
It would mean everything to his legacy. For his legacy, I feel like his death wouldn't be in vain.
And right now, organizers are working to secure funding for this initiative through grants and fundraising efforts. Switching gears.